Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon. I've reviewed your recent tests and noticed a few concerns we need to address. But first, how have you been feeling overall?
Well, doctor, I've been feeling pretty overwhelmed. My job in the foreclosure market has been really stressful, especially with how volatile it is right now. I think it's taking a toll on my health.
Stress can definitely impact your physical health, including your blood sugar levels. You mentioned your job a couple of times. Can you tell me more about what's been happening there?
It's just been very hectic. The uncertainty, dealing with difficult cases, long hours, it's a lot. I try to manage, but it seems like everything I do is just not enough to keep my health in check.
I see, and with your diabetes, managing stress is crucial. You mentioned your blood sugar levels have been high. Can you tell me more about your current regimen and diet?
I'm on metformin, 1,000 milligrams twice a day, but my sugar is still all over the place. I average around 244, even higher sometimes. My diet isn't great, admittedly. I tend to skip meals, and when I do eat, it's whatever is quickest, which isn't always the healthiest option.
Understood. It's good you're acknowledging these challenges. What about your activity levels?
I've cut down a lot, especially in the winter. I used to go for walks, even hit the gym occasionally, but lately I just don't have the energy or time.
That decrease in activity can also contribute to your high sugar levels. Let's also touch on your other health concerns. How's your acid reflux?
It's been tough, especially around midday. I feel this burning sensation, and I usually eat something to calm it down, which I know isn't ideal.
Right, and we've started you on omeprazole to help manage those symptoms. Now, regarding your cholesterol and gout, any recent episodes or changes in symptoms there?
No recent gout attacks, but I've been taking Tylenol when I feel an episode might be coming on. As for cholesterol, I'm not sure. I know it was borderline last time.
We'll check your levels today. You also mentioned your prostate health in the past. How has that been?
It's been stable as far as I can tell. I'm still on that medication starting with O. I can never remember the name, but no new symptoms.
That's good to hear. It's important we keep monitoring that as well, especially with your history. You've quit smoking over 2 decades ago, which is excellent. Have you been around any smokers or in environments where you're exposed to smoke?
No, I've stayed clear of any smoke. It's one of the few things I've managed to stick with.
Very well, let's go over your test results now and formulate a plan moving forward. Your latest fasting glucose is 244 milligrams per deciliter and postprandial is 278 milligrams per deciliter. Your A1C has climbed to 9.2%, which is quite high. This indicates your current regimen isn't controlling your diabetes effectively. Your cholesterol is at a total of 198 milligrams, with LDL at 104 milligrams and HDL at 38 milligrams per deciliter. Triglycerides are 220 milligrams per deciliter, which is also higher than we would like. Your kidney function shows some decline with an eGFR of 59 milliliters per minute, 1.73 milliliters per hour, and liver tests are within normal limits, which is good. Your PSA is at 5.6 nanograms per milli, so we will need to keep monitoring that closely. In terms of your diabetes, I would like to add glipizide to help increase insulin secretion. This should help better manage your blood sugar levels. For your acid reflux, continue with omeprazole as prescribed. We need to seriously consider lifestyle adjustments, more structured exercise, improved diet, and perhaps even stress management techniques could be beneficial for you. I want you to monitor your diet more closely, possibly keep a food log. This can help us see where the gaps are and how we can adjust things. I'll also need you to undergo immediate lab tests for hemoglobin A1C and kidney function today, and we'll monitor your cholesterol levels as well. Let's plan for you to report your blood sugar levels to me in a month, and we'll schedule a follow-up appointment in 3 months. It's important that we get these issues under control to avoid further complications. How does that sound to you?
It sounds good, doctor. I know I need to make these changes. It's going to be tough, but I understand it's necessary.
I'm here to support you through this. We'll review everything in detail during your next visit and adjust the plan as needed based on how you're doing. Remember, it's about taking small steps towards a healthier lifestyle.
Thank you, doctor. I'll do my best and keep you updated on my progress.
That's what I like to hear. Let's get those lab tests done today, and I'll see you back here in a month. Take care until then.
Will do. Thanks for your help, doctor. See you soon.
You're welcome. See you soon.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
I've been managing my cholesterol pretty closely, and it's been an uphill battle with my work schedule being so hectic. I try to squeeze in exercise whenever I can, but consistency is hard. I notice some improvement, though, since I'm eating less red meat now.
I see you've been making some positive changes, which is great. Your LDL is currently at 136, which is within our target given your history. Keep up with the dietary changes, and let's keep monitoring the cholesterol levels.
Regarding my ankle, the pain flares up occasionally. It's been over a decade since my last surgery, and I've been using Vicodin for pain. I ran out of my prescription, and you mentioned Norco last time.
Yes, considering your history of surgery and ongoing discomfort, switching to Norco might provide you with more consistent pain relief. It's important to manage your pain effectively, especially with your active job.
I use a CPAP at night for my sleep apnea, and it has really helped. But I remember, years ago, an ultrasound indicated I might have a fatty liver. Should I be concerned about that affecting my health further?
It's good to hear the CPAP is helping. As for the fatty liver, it's something we should monitor, especially with your cholesterol issues. We can discuss dietary strategies to address both your cholesterol and liver health.
I had a tetanus shot back in 2008 after stepping on a nail. We talked about the Tdap vaccine before. How necessary is that for me?
The Tdap is important as it covers tetanus, diphtheria, and pertussis. Given that your last tetanus shot was over a decade ago, it's advisable to get the Tdap to stay protected.
I've always been hesitant about flu shots. I haven't had the flu in years, and I'm not sure I need the vaccine.
I understand your reluctance. However, considering your irregular work hours and exposure, the flu shot is recommended as a preventive measure. It's especially important given your environment and the stress on your immune system.
About my diet, I've been cutting down on cholesterol-rich foods. It's tough with my schedule, but I'm managing. How am I doing with that, given my cholesterol levels?
You're making good progress. Your efforts are reflected in your LDL levels, which are within the goal range. Continuing on this path and incorporating more fruits, vegetables, and whole grains will further benefit you.
Let's talk about advance directives. After seeing what happened with my family, I think it's something I need to consider seriously.
It's wise to think about advance directives early. We can discuss your preferences and ensure that your wishes are documented. This will guide your care should you be unable to make decisions yourself in the future. Let's summarize today's visit. Your cholesterol management is on track with an LDL of 136. We'll continue to monitor this closely, adjusting diet and medication as necessary. For your ankle pain, switching from Vicodin to Norco can be beneficial for managing the symptoms effectively. Keep using the CPAP machine as it improves your sleep quality, which is crucial for your overall health. As for vaccinations, updating your Tdap is advisable, and I would recommend considering the flu vaccine, especially given your work environment. Regarding your liver health, it's stable, but let's be proactive with dietary management to avoid complications. Finally, it's good you're considering advance directives. It's important to plan these things early. We'll schedule another appointment in a year unless issues arise sooner. Your next steps are to start on Norco for the ankle pain, continue with the dietary adjustments, and consider getting the Tdap and flu vaccines. I'll also arrange for a follow-up on your liver health and cholesterol in 6 months to see how things are progressing. In the meantime, please reach out if you have any concerns or if your situation changes.
Thank you for the comprehensive summary. I've been trying to stay on top of everything, but it's a lot to manage with my job's demands. About the Norco, what should I be aware of in terms of side effects or dependency?
It's good that you're mindful of these issues. Norco can be effective for pain, but like all opioids, there's a risk of dependency. We'll start with the lowest effective dose and monitor your usage closely. If you notice any side effects like dizziness, nausea, or changes in mood, you should let me know immediately.
I've heard a lot about opioid issues lately, so that does worry me a bit. I'll be sure to monitor how I feel with Norco.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Let's review your medications. You're currently on a beta blocker and an ACE inhibitor for your blood pressure, correct?
Yes, that's right. I've been taking those for a while now.
How have you been feeling lately? Any dizziness, headaches, or other side effects?
I've been somewhat dizzy occasionally. It's not severe, but it's noticeable.
Dizziness could be a side effect of the medications, especially if they're lowering your blood pressure too much. We might need to adjust the dosages. You're also on a statin for cholesterol. Have you been eating grapefruit or drinking grapefruit juice?
Yes, I have grapefruit juice every morning.
Grapefruit juice can increase the levels of statins in your blood and can lead to serious side effects. I recommend stopping the grapefruit juice immediately. Let's also schedule some blood work in a few weeks to see how the medication adjustments are working and ensure your liver enzymes are stable.
Okay, I'll stop the grapefruit juice, and I'll wait for the appointment for the blood work.
Great. It's crucial to keep track of how you're feeling with these changes. If you notice any other side effects or have any concerns, please contact me immediately. We need to ensure your treatment is effective and safe.
Now look at question 26.
Thank you for joining today's session on diabetes management. It's vital to understand how lifestyle choices can impact your blood sugar levels. Can anyone share their experience or challenges with managing diabetes?
I find it hard to resist sweets, especially during family gatherings.
That's a common challenge. It helps to plan ahead for such occasions. Perhaps you could bring a diabetes-friendly dish that you can enjoy without worry. It's also important to monitor your blood sugar regularly. Does everyone here know how to use a glucometer?
I do, but I sometimes forget to check my levels regularly.
Setting reminders on your phone can help. It's also beneficial to keep a daily log of your food intake and blood sugar levels. This can help you understand how different foods affect your glucose levels. Additionally, I will provide some resources on meal planning and how to make healthier food choices. Our goal is to empower you with the tools you need to manage your diabetes effectively and prevent complications.
That sounds helpful. I appreciate the practical tips.
You're welcome. Managing diabetes is a team effort. Make sure to communicate with your healthcare provider about any changes in your condition or if you need help with your management plan.
Now look at question 27.
Today, we'll work on some exercises to help with your knee recovery. Let's start with the seated hamstring stretch. Extend your leg and gently reach toward your toe. Hold this stretch for about 15 seconds. Tell me if you feel any discomfort.
It feels tight, but not painful.
Good. That's what we're aiming for. Next, let's do some quad sets. Tighten the muscles on the top of your thigh as you press the back of your knee down into the mat. Hold each contraction for about 10 seconds. These exercises will help strengthen your knee and improve stability.
I can do these at home too, right?
Absolutely. I encourage you to do them daily. Consistency is key in recovery. Next, we'll try a gentle calf stretch. Place your injured leg behind you and gently press the heel down. This will help with flexibility and mobility. As you progress, we'll introduce more exercises to continue building strength.
Thank you for explaining these. It helps to know what each exercise is supposed to achieve.
Of course, understanding the purpose behind each activity will help you focus on doing them correctly. Let's review these again to ensure you're comfortable with the technique.
Now look at question 28.
Thank you for joining me to discuss your genetic testing results. Today, we'll go over what the findings mean and how they might impact your health decisions. You've tested positive for a variant associated with an increased risk of a specific genetic condition. This doesn't mean you will definitely develop the condition, but it does increase your risk.
What should I be doing differently now?
First, it's wise to undergo regular medical screenings that can detect early signs of the condition. Preventive measures can significantly impact your health outcome. Lifestyle changes, such as a healthier diet and regular exercise, can also play a crucial role. Additionally, there are medications and therapies that can be used prophylactically to reduce your risk.
Should I tell my family about this?
Yes, informing your family is important because they may also carry the same genetic variant. They might consider getting tested to understand their own risk factors. Genetic counseling can be helpful for them to comprehend the implications and decide on the best course of action.
This information may feel overwhelming, but you're not alone. I'll provide you with resources and support groups. Ongoing research and advancements in medicine are continually improving our ability to manage risks associated with genetic conditions.
Thank you for the detailed explanation and resources. This helps me understand what steps I need to take next.
You're welcome. It's important to stay proactive and engaged with your health. Let's schedule a follow-up appointment to discuss any further questions you might have after digesting this information.
Now look at question 29.
Good afternoon. I noticed from your intake form that you observe kosher dietary laws. We want to ensure your stay with us is as comfortable as possible, including adhering to your dietary needs. We have kosher meals available, and I can assist you in selecting your meals during your stay. Would you like to review the options now?
Yes, please. It's important for me to maintain my dietary practices even while I'm here.
Absolutely, we respect that completely. Here are the meal options that are certified kosher. We also ensure that they are prepared in accordance with kosher guidelines. Do you have any allergies or specific preferences within these guidelines?
I need to avoid dairy. Can you show me the options that are Pareve?
Of course. Here are the Pareve meals, which don't contain any meat or dairy. We can also customize the meals if you need more options. It's important to us that you receive nutritious meals that meet your dietary laws and help with your recovery.
Thank you for being so considerate and accommodating.
You're very welcome. It's our priority to ensure that all our patients' needs are met, respecting their cultural, religious, or personal preferences. If there's anything else you need to make your stay more comfortable, please let me know.
Now look at question 30.
Today's session is focused on the organ donation process, a crucial component of saving lives through transplantation. The first step is always consent. Individuals may register as donors, or families may decide at the time of their loved one's passing. It's a profound gift that has the potential to save multiple lives.
What happens after someone consents to donation?
Once consent is confirmed, our team performs comprehensive medical and social history reviews to ensure safety for both donors and recipients. We then proceed with tissue matching. This involves sophisticated tests to match organs to individuals on the National Transplant Waiting List, prioritizing those most in need and best matched.
Is the family involved in the process after consent?
Absolutely. We keep the family informed every step of the way. We provide support through specialized coordinators who handle all aspects of the process with the utmost respect and confidentiality. We also offer grief counseling and support services to help families during this difficult time.
How are the recipients chosen?
Recipients are selected based on medical urgency, compatibility, and sometimes the length of time they have been waiting. Our goal is to use every donated organ to save lives while ensuring the best possible outcomes for transplant recipients. It's a careful, ethical, and compassionate process managed by a dedicated team of professionals.
I encourage anyone interested in becoming a donor to speak with our coordinators. They can provide all the necessary information and help you register. Organ donation is a powerful legacy, one that leaves a lasting impact on many lives.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Welcome. I'm Dr. John Carter, and today we'll explore how statistical analysis helps us understand and manage outbreaks, with a specific look at a case study involving a COVID-19 patient. Joining me is Dr. Lisa Reynolds, an expert in epidemiology and infectious diseases.
Thank you, Dr. Carter. It's crucial to discuss how we use statistical data to understand diseases better, especially in the context of a pandemic. Today we'll focus on a case study that highlights the importance of data in managing COVID-19.
Exactly, Dr. Reynolds. Let's dive into the case of Mr. Smith, a 55-year-old male who presented with symptoms of COVID-19 and was part of a study that tracked the spread and severity of the virus among different demographics. His case provides insights into how statistical models are vital in predicting outcomes and shaping public health responses.
Mr. Smith's case was particularly interesting because it illustrated several key points about the virus's behavior. Initially, Mr. Smith reported mild symptoms, which then progressed rapidly. The study collected data like this from thousands of patients to estimate the disease's progression rate and identify factors that predict severe outcomes.
That's right. By applying statistical tools, researchers analyzed data from patients like Mr. Smith to calculate the basic reproduction number, or R0, of the virus, which measures its contagiousness. Understanding these metrics helped health authorities decide when to implement or lift restrictions.
And from a clinical perspective, Mr. Smith's data contributed to our understanding of the risk factors associated with severe disease. The study used multivariate analysis to identify that older age, underlying health conditions, and certain clinical symptoms were linked with higher rates of hospitalization and severe outcomes.
This kind of analysis is crucial for resource planning in hospitals. For instance, knowing that patients with profiles similar to Mr. Smith's might require more intensive care helps in the allocation of ICU beds and ventilators.
Absolutely, Dr. Carter. Additionally, the study highlighted the importance of timely data collection and sharing. As Mr. Smith's condition evolved, real-time data updates enabled quick adjustments to treatment protocols and public health strategies, reflecting new insights into the virus's behavior.
Statistical analysis also plays a role in evaluating treatment efficacy. For Mr. Smith and others in the study, data were used to monitor responses to various treatments, which were then statistically analyzed to determine which therapies improved patient outcomes.
And let's not forget about the role of predictive modeling in public health policy. The data from this study, including patients like Mr. Smith, were used to forecast potential future spikes in cases, helping to prepare for and potentially prevent further outbreaks.
Dr. Reynolds, it's clear that Mr. Smith's case is just one of many that collectively inform our broader understanding of COVID-19 through statistics. Your expertise has provided our listeners with a deeper appreciation of how data shapes our fight against pandemics.
Thank you, Dr. Carter. It's been a pleasure discussing the intersection of statistics and clinical care, and I hope our listeners now see how crucial data is in managing not just COVID-19, but all public health crises.
To our listeners, remember, behind every statistic is a story, and each data point helps us build a clearer picture of the pandemic.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Hello everyone, and welcome to today's educational session where we'll be exploring complex interventions in peripheral artery disease, or PAD, particularly focusing on the significant findings from the Voyager PHAD trial. Our goal today is to delve into the nuances of treatment modalities following revascularization and to examine a relevant case study that underscores the practical applications of these findings in clinical settings. Peripheral artery disease is a common, yet under-recognized condition that affects millions worldwide. It is characterized by atherosclerotic obstructions in the arteries, particularly those supplying the lower extremities, leading to significant morbidity and mortality. The management of PAD is complex, especially post-revascularization, as patients are at a high risk for recurrent ischemic events and other complications. Recent advancements in the management of PAD have been highlighted by the Voyager PAD trial, published in the New England Journal of Medicine. This trial focused on the use of low-dose rivaroxaban, an anticoagulant, in addition to aspirin, compared to aspirin alone, following revascularization procedures like stenting or surgical bypass in PAD patients. The trial's results were promising, demonstrating a significant reduction in the risk of major adverse limb and cardiovascular events with the addition of rivaroxaban. Specifically, the study found a 15% relative risk reduction in the composite outcome of acute limb ischemia, major amputation for vascular causes, myocardial infarction, ischemic stroke, or cardiovascular death. Now let's consider a case study to better understand these findings and their application. We have Mr. Smith, a 62-year-old male with a history of smoking and diabetes, who presents with critical limb ischemia. He recently underwent a peripheral artery revascularization due to severe atherosclerosis in his lower limbs. Post-operation, his management is crucial to prevent the recurrence of ischemic events. In Mr. Smith's case, following the guidelines from the Voyager PAD trial, he was started on a regimen of low-dose rivaroxaban and aspirin. This decision was based on the trial's evidence suggesting that this combination reduces thrombotic risks significantly without a proportional increase in major bleeding events. The trial reported an absolute risk reduction of 2.6%, translating to a number needed to treat of 39 to prevent one primary endpoint event, a compelling statistic favoring the use of rivaroxaban. Furthermore, it's important to discuss the safety profile of this treatment regimen. While the trial did indicate an increased risk of bleeding, the benefits of adding rivaroxaban in reducing severe ischemic events outweighed these risks. For Mr. Smith, monitoring for signs of bleeding becomes a critical aspect of his postoperative care, alongside regular follow-ups to assess limb perfusion and function. This case highlights the nuanced decision-making required in managing PAD post-revascularization, balancing the benefits of thrombotic risk reduction with the potential for bleeding. It also emphasizes the importance of a personalized approach, considering the patient's overall risk profile and comorbidities. The Voyager PAD trial presents a significant shift in the management of PAD patients post-revascularization, advocating for the inclusion of low-dose rivaroxaban with aspirin. This combination therapy addresses the high thrombotic risk in this patient population, providing a clear guideline for improving outcomes. As we integrate these findings into clinical practice, it is imperative that we continue to monitor and evaluate the long-term impacts, ensuring that patients like Mr. Smith receive the most effective and safe care possible. Thank you all for joining today's session. I hope this discussion enhances your understanding and management of PAD in your clinical practice. Please feel free to reach out with any questions or for further clarification on today's topic.